My name is Ranjot Singh, and I usually go by Dr. Singh. I've been with Decatur Memorial Hospital since August 2014. And prior to coming to Decatur, I did my general surgery residency in Cincinnati, Ohio. Then I went on doing a colon and rectal surgery fellowship, which is a one-year program to specialize in diseases of colon and rectal surgery in Mount Carmel, Columbus, Ohio. I'm dual board certified in general surgery and colon and rectal surgery. This gives me a really unique opportunity to take care of a broad spectrum of disease processes and surgical procedures to help my patients and the community. I believe in three pillars of medical care: compassionate care, multidisciplinary care, where I want to make sure when the patient comes here, they're not just my patient, whosoever is involved with the care. We want to coordinate that care so they get the better care. And I also believe in evidence-based care, meaning medicine is such a dynamic change, things change every day, so I want to make sure the care which is provided to my patient is up to date for the better outcome and patient satisfaction. We treat every patient just like my own family member. Our environment is so relaxed that they feel like this is a home. We sit down, have a conversation at the same level, and give them enough opportunity so they can ask questions. There's no rush. And my rule of thumb is never rush. My patient is here with me. At that moment in time, he's my only priority. I ignore everything what's going around me, so that give a unique perspective to my patients that they feel very comfortable. And I like to explain them by drawing the diagrams. I go over everything in detail in layman terminology, answer every single of their questions, and I hope by the end of this discussion with the patient, they always feel much comfortable. I do advanced laparoscopic procedures, and I also specialize in advanced robotic surgery procedures. And I've been doing this since 2014. I also take a pride in teaching the community and educating the community about different aspects of colon and rectal diseases, such as colon cancer, rectal cancer. We also want to make sure in the community the screening for colon cancer and rectal cancer is high enough that we can reduce the incidence of colon and rectal cancer. So we signed the pledge in 2018 to achieve 80% of screening rates in the community by 2018. That is going great, and now that rate is keep on improving. We developed a rectal cancer center of excellence where we want to provide a comprehensive rectal cancer care utilizing multidisciplinary approach, evidence-based medicine. So we are actually approved rectal cancer center of excellence for the last 3 years. We are the first handful of the institutes in the entire US who was approved for that care.